All right, let's go ahead and kick off. Wow, I've never seen a participant list grow so quickly. That's awesome. Thank you, everyone, and good afternoon. Thanks for joining us today. On behalf of the Healthcare Sim Week Planning Committee, happy Healthcare Simulation Week 2023. We're so glad you're here to join us for the Champion Circle. As the planning co-chairs this year, were discussing this early on, we realized that there's so many amazing things that everyone in this community is doing, and very seldom do we have the opportunity, mostly because we're so busy, creating such unique and fantastic educational activities. Very seldom do we have the opportunity to take a moment and reflect on all the achievements and successes that we've done. And that was really the impetus behind the Champion Circle. So we shifted our focus slightly this year and really wanted to celebrate some of the successes that you and your teams have experienced and provide kind of this open forum where we can share some stories, ask some questions, and build connections. So that being said, the ground rules for the next half hour or so there aren't really any. It's simulation, right? So this is meant to be an open forum and a free-flowing conversation. Low stress, keep it collegial, and we're really looking forward. We've got a couple guest speakers here with us today, and we're just looking forward to everyone having an opportunity to share their ideas and to share their successes with us. That being said, I'll give you a quick intro. My name is John Alex. I'm the medical director of the Riverside Simulation Training Lab in Newport News, Virginia. This is my first year helping out and really participating with Healthcare Sim Week, and it's been extremely educational and rewarding. And I just look forward to celebrating with all of you this week. Priscilla?
All right. I'm so excited to see all of you. This is really a celebration. So welcome and thank you for coming. And thank you for our Erica and Michelle, who will be sharing their success story. And I'm sure everybody have many, many successes to share. So I'm very excited. My name is Priscilla Lowanson. I am the Director of Simulation Education, the Center for Advanced Medical Simulation here at Mount Sinai in New York City. So welcome and enjoy the whole week. Thank you. Shannon.
Yeah, thank you. And I'm Shannon DeMarco. I'm the last of the planning co-chairs to introduce ourselves. I come to you from the University of Wisconsin in Madison, where I'm the Administrative Director of Clinical Simulation and Emergency Education. We are supported by UW Health and the School of Medicine and Public Health. I want to welcome everybody here, and I'm starting to see people in the chat already kind of doing what I was going to ask, is kind of putting in a hello and greetings and where you're from. We're seeing already people from across different parts of the world, Brazil, Boston, Ireland. So please put your name and your institution into the chat. We love to hear where you're from. And just kind of giving you an idea that right now on SSH website right now, we have over 80 events published from 19 different countries of people celebrating Healthcare Simulation Week. So we really are so appreciative of everybody sharing their time that they're going to be using for Healthcare Sim Week. So check out that calendar. Let us know what you're going to be doing. Really excited to see everybody here. And the last thing I'll say is, you also have an opportunity to pin your center on the map, the Healthcare Simulation Week map. That would be awesome, because we want to see where the sim centers are across the world so we can connect with our colleagues here and near and far. So now I'm going to send it over to Erica to introduce herself and kind of talk about a little bit about her champion story, about her success story for herself. And then we'll also have Michelle come over and introduce herself as well. So I'll start with Erica. If you want to go ahead and introduce yourself and give us a little bit of your story.
Yeah, absolutely. Thank you all so much, John, Shannon, Priscilla, for hosting this. This is obviously a really great kickstart. As John had mentioned, just a bunch of people flowing in very quickly. So very exciting that people are joining us. But as Shannon said, my name is Erica Hinojosa. I'm the Simulation Technology Manager at the University of Texas at Arlington College of Nursing and Health Innovation Smart Hospital. But I'm also the current president of SimGhost, and that's part of why I'm invited here to talk a little bit about that. And I've been in simulation for a little bit over 8 years, and I was very fortunate that during my undergraduate, I got to work in our sim center. So my undergraduate doesn't have anything to do with sim, it's in exercise science. And because I had the opportunity really early on to see those implementations and see simulation, it made me really excited. And so when I graduated, I was able to get a job as a simulation technician. And I did that for about 2 years and moved into management, all within the same facility at UT Arlington. And then shortly after, I was ambitious and wanted to get my master's, which I did at the University of Alabama, Birmingham, which is a master's in healthcare simulation, which is with some of these folks here like Shannon and Michelle, which is really excited that we've continued that circle of friendship and being able to be involved with each other all throughout the year. And at the end of getting my master's, I was on maternity leave. That was the same year that my son was born. And so like, cool, I get to finish my master's. I get to spend time with my newborn son. And as soon as I got back, there was just a slew of emails that I ignored for 6 months because I didn't have to respond to anything. And that's when the CHSOS-A was launched. And I wanted to be one of the first people to get it because it was that first cohort. And so within a week's time, I just typed away, got that whole application done. If you completed the application for any of the CHSEs or A's, CHSOS, NAs, it's very lengthy of a process. You have to have references, you have to fill out quite a bit of information, you have to have examples of everything. But that was something that I really wanted to get. So in coming back January of 2021, I did that. And then I think it was released in March, and somebody please correct me if I'm wrong, because I can't now remember that. But it just kind of was a revolving quick process. So I received my master's, I got my CHSOS-A, I got an email from SIMGOS, which is a lot of what I want to be talking about today, to join the board of directors. I did the letter of intent. I got invited for an interview. I then joined the board of directors. I then moved into a secretary position, and then I've now moved into the president's position, which was about a 2-ish year journey from joining the board into becoming president. So for those who haven't heard of what SIMGOS is, we are the gathering of healthcare operations simulation technology specialists. And we are an international nonprofit organization that helps individuals and institutions use the space and technology in those spaces through hands-on workshops, professional development, and online resources.
Great. Thank you, Erica, for that great introduction. So proud of you and all your accomplishments. So now I'll send it over to Michelle. Michelle, if you want to introduce yourself and tell us just a little bit about your background of your success story.
Sure. Thank you. I am Michelle Brown. I am at the University of Alabama at Birmingham. Erica Hinojosa just kind of mentioned it. I am the program director for our healthcare simulation master's program. We've also recently developed a academic certificate. I am an associate professor in the School of Health Professions and an educator in the Office of Interprofessional Simulation, which is kind of our campus-focused simulation center. And then I also work in our health system as an educator with clinical simulation there. And so I do simulation all the time, and it's really fantastic. And so a little bit about my background, clinically, 25 years ago, I started out as a medical technologist, working mostly in the blood bank and hematology. And then came to campus maybe 10 years later, was teaching blood bank, and I'm walking through our campus buildings, and I kind of look to my right, and I see mannequins, which I probably called them dummies back then because I didn't know anything. So I just looked in there and I'm like, oh, they have those things. What do they do with those things? And so this was, oh gosh, maybe 17 years ago. And so I found someone in the simulation center. She happened to be the director because back then it was really like a one-person show. And I said, tell me a little bit about it. This is cool, because I was always interested in doing things that were not the sage on the stage type of education, but also this was 17 years ago, technology was a little different. And she was talking about some of the simulations she does. And I said, how do you represent, or how do you share lab results when you're in your simulations? I mean, we all do simulations all the time. There's always lab results. And so with that being my professional background, I asked, and she honestly, I'm holding up a Post-it right here, because she essentially took a Post-it out of her pocket and said, well, when we share, something printed. And I was like, oh my gosh, my whole profession has been relegated to a Post-it note. This is not good. And so got involved in doing simulation
from a laboratory perspective, a medical laboratory science laboratory perspective, we were one of the first groups to get the laboratory really meaningfully involved in interprofessional simulation, because it's quite different, because we have to use blood and body fluids to really have something meaningful for the lab students. And so how do you work that out and still keep a physically safe space? But we've done it many times over. And then, UAB has a reputation for some pretty strong facilitator development courses. And we had kind of half-day courses, full-day courses, and we would kind of offer a little bit of like a week or a 3 or 4 day thing, and got some momentum around that. And then eventually we were meeting and we kind of thought, simulation just isn't a methodology, it's a profession. And so maybe a master's degree is something we need to consider. Drexel had their master's degree, and there were 2 others internationally, where there were master's degrees in simulation out there, but it was like, ooh, do we bring this to the University of Alabama at Birmingham? And we did, and it's been very successful. We started a program, we started in 2017, took our first students in 18, and really kind of my success story is that they asked a laboratorian to lead a healthcare simulation master's program, which I think is just fantastic. And so for those of you who are thinking, do I have the right background for leadership? Maybe Erica and I can serve as inspiration to say, neither of us were thinking about simulation when we were getting our undergraduate degrees. And now we're both in leadership positions. And so hopefully a little bit of my trajectory or Erica's trajectory will help, somebody out there, somebody in the 36 of you or whatever, say, oh, okay, I don't have to have this particular background, whatever it is you've told yourself in your head. I can lead, from because of who I am and what I bring to the table. So that's a little bit, Shannon.
Michelle, Erica, those are great stories, and it made me consider something too. I wonder how many people in the room right now happened into simulation. I think very few of us just started. So feel free, if you want to throw a reaction up and raise your hand if this was something you never thought you would do. I'll share my own experience. I was a chief resident. I'm an emergency physician, and in my training, when I was selected to be a chief, my program director asked me to run the simulation program, and I respectfully declined. 12 years later, here we are. So it's interesting, the journey that we all take. So very cool.
Yeah, and I would agree. Mine's kind of similar to, Michelle and Erica's in a little bit of way. And I'm not a clinician either. I don't have I mean, Michelle has a technician background, but I actually come from, communication and adult learning theories, and kind of looking at that, and working in higher education and healthcare was never something that was ever, ever part of my path. And, thanks to Michelle's leadership, to give her a little plug, and her mentorship of me, I realized that I can be a leader in simulation, even without the background in specifically direct to patient care. So great. I think we're going to start with, Priscilla, did you want to?
Yeah, I just want to share a little bit. I think I started simulation when I was 7 years old. When simulation was not the word yet, I always want to simulate my teacher, to the point that I will call all the neighbor children, and gather them at 3 o'clock in the afternoon. And then I'll start teaching them. And then finally my father saw that I like to simulate. So he bought me a portable blackboard. And so I started teaching. And then I am so happy that there is a world simulation, the world of simulation, and it's very universal. I can tell that it doesn't matter what discipline you are. There is the spirit of simulation, the shared mental model of like, hey, we want to do this for the world, and we want to make a difference. So that really excited me, hearing Michelle, hearing Erica, and I always think like healthcare simulation. And I'm just so curious, as we always say in simulation, I'm curious. So I'm curious to know the rest of our participants as well. Thank you.
My son is 3 years old, and we just moved into our new building here at UT Arlington. And he's a very technical mind type of kid, and he loves coming up here and working on the patient simulators. I happen to have a hard hat and screwdrivers in my office, and he's like, okay, where are the mannequins? Like, nothing's broken per se, but he's ready to fix everything and anything. And so going back to, you've known about simulation and been interested in since you were 7, I think he's going to be just about the same, just like that kind of curiosity and engagement early on.
Great. Well, we'd like to open up some questions to our panelists, so Michelle and to Erica, and then ask anybody that wants to chime in too and talk a little bit about this. So I'll go ahead and pose the first question that we have for you all and let Erica or Michelle respond if you'd like. And then anybody else that wants to join in, if you'd like to, raise your hand in the chat, I can kind of monitor that and make sure that if you have your hand raised, that you get a chance to talk about some of the answers to the questions we're going to ask. So I'll start with the first question, and I'll ask Michelle to answer this question first. So when you think of success in healthcare simulation and your program, how do you generally define that?
Oh, I think it is completely individualized, and not just to the person, but the context. I think success is when you're able to meet a particular need or meet a goal. And that sounds like such a textbook response. And like, I'm like recognizing that and naming that and putting it out there. But I think success, I think we need to celebrate the small successes. And so when there's an identified need and you're able to work together, you bring the right people to the table, you're able to work together as a team to meet it. I think what's important is to celebrate it. I've even, just from all the years of working, UAB is I think it's the 3rd largest public hospital health system in the US. And so I've even said to some leadership when I'm over in the health system, say, we need to celebrate. Sometimes we're so task focused that we're moving on. We need to do this for patient safety, do this for, whatever we're doing in education, because I kind of work on both sides in the health system and on campus. And it's like, hold on, let's celebrate. And so it's identifying a need, talking to the people and finding whoever the people are, whoever is looking to us to help them meet a need, or whoever we have sought out because there is an issue. But working together to identify the need to meet it. And then let's not forget to celebrate. And then personally, like personal success it's all about relationships to me. Before you all joined and I got on the Zoom call and was able to see Shannon and Erica, having taught them so many years ago, I was all flushed and all excited. And it's just because success to me is new relationships and maintaining relationships. And the idea that Erica, you talked about circle of friendship. I even wrote it down. That was fantastic. And so to me, strong relationships really scream success.
Great, thank you. That's such a great statement. I appreciate it. And the little props, that's good. Erica, do you have anything to add to that? And don't forget to raise your hand or put a comment in the chat if you have things that you would like to from our participants, if you want to talk about how you define success in healthcare simulation.
Yeah, so just to add on what Michelle was saying, so Shannon had emailed me last week, and I had all weekend to think about some of the questions that were going to be asked today. And I really had to dig deep in myself because I haven't really taken a seat to think about these questions and success. And I just feel like my life right now is just rapidly rolling, and I'm just trying to keep up with my personal life, with work life. And as I was thinking about what does success look like? What does that look like as an individual or in your organization? 3 words really stuck out to me, which was passion, motivation, and excitement, which does kind of piggyback off of what Michelle was already mentioning. And if you're not excited about coming into work every single day, then it's going to be a tough day, even if you're really good at it. And so I think team dynamics and having your mission and vision very clear in your sitting together as a team, moving towards that mission and vision is very important as well. And the motivation to get up and go to work every single day, who you're working with, and those relationships, those friendships that you have, that makes me excited when I come to work every day. And it also makes the tough days that are really hard much more fun because of that, because I have people who are cheering me on and who are very supportive in that environment. And I know that may not be the case for everybody, but that's kind of some of the things that I'm looking for in my leadership, in leadership above me, and in my team as well. And then of course, passion. So what makes you, these all kind of tie into each other. What makes you passionate about it? as an individual, as a team, for your students, your learners, things like that. So
Priscilla here. I'm curious, to know from the audience, when you hear champion of your success story, what does it mean to be a champion of your success story? Maybe our panel can discuss as well, but if you want to share through the chat, I'm really very curious what the whole world in the simulation community kind of like define or share what the champion of your own success story means to you.
I can jump in first. So I think here champion's used as a verb, or I would see it as a verb. So supporting a cause, which then comes down to being an advocate, right? So everybody who's a champion of success is an advocate to their discipline. So for me, an operations specialist, simulation technician, leadership type of roles, those are the things that I fight for and stand up for every single day. And I'm an advocate as I'm a panel discusser right now, or as I go around the world to different conferences and different sessions as a presenter, as the leader of SimGhost as well. And so I think that it's awesome to see what those champions of success look like in those disciplines, and seeing that them being advocates.
Yeah, I think it's sometimes hard to be a champion of your success story, because it can really sometimes feel like you're tooting your own horn. And who wants to sit in a room with that person, even a Zoom room? But I think it's so much how you frame it and why you're sharing it. And, are you using it to make a connection? Are you just talking about yourself and you're not listening to the person that you're having a conversation with? But being, or is it to make connections and to find things that you have in common? And really, I love to be a connector of people, never the smartest in the room, never the best at whatever, but I bet I can find somebody who is. And so I love to be that connector. And so being a champion of your own success story can really be a challenge, but I think it's about sharing successes, sharing challenges. I think sharing challenges is also being a champion of your success, because somewhere eventually there's going to be some kind of success at the end of this challenge. It could be that you had to divert and take a whole different road. Well, sharing that story with someone is going to help that person. And so getting to a place where you can share successes, you can share failures, you can, form relationships, is really important. And speaking from the program director of our master's program, I love to share our student success stories. And so maybe that's one way where I recognize that as I'm sharing how amazing Erica is and how amazing Shannon is, and how amazing all of our other alumni are, I'm also sharing, like, look at our program. We have fantastic people in here, and we have the right content that people are looking for. And like an example of maybe a way I would share like a success story for me is, I just had a student in the last couple of weeks say, every week, whatever we're learning this week, I apply. She's a director of a sim center up in Canada. I apply this the week we're learning it. And so when I share that, what I'm sharing with people is that we've created a really good program with content that people use right away. And so sometimes it's how you share things, that would be really different than me talking about this wonderful program and how many hours I teach and how many research papers I have. It's how you share it. But it is so important that we share it, because just as we've emphasized over the last 20 minutes, most of us are homegrown. We stumbled into simulation. And so if we're not sharing how we gained success, people aren't learning. I mean, we have to share our successes. If you don't share your successes, other people aren't. They're not going to do that. And so, but it's really the air with which you celebrate it, I think.
Thank you so much, Michelle. John, do you want to wrap it up?
Yeah. So Michelle and Erica, the things you were saying right now, I got to tell you, both of those discussions really resonated with me. I can't stand being the person in the room tooting my own horn, but there's purpose behind that, right? Because these things that we've accomplished, these things that we've gone through, it wasn't a defined trajectory. We're all homegrown. So a lot of these things we've had to redirect or find ways to manage. And I think some of that horn blowing, if you will, gets us the seat at the table. You know what I mean? And that allows us, to Erica's point, to begin to advocate for others as they are trying to follow in a similar path and similar footsteps. So I think that's fantastic. And I couldn't agree more. Also, you talked about connecting people. Our lab is in a community hospital, and we're a pretty new program. We've only been open for about 3 years. And I find on any given day, we're kind of a central node. So there's a lot of people that will come talk to me and share ideas, but they might not talk to each other. And being able to connect those dots, like you said, Michelle, I think is really important.
I believe, John, like the IMSH 2024 really would be something that you will be so curious. Again, I'm using the word curious to know more about champions of success or champions of circle of success, is because it will be talking about advocacy. So precisely what Erica was saying, and the challenges of advocacy. So I think get there and register IMSH 2024. Yeah. So Shannon.
Yeah, we have just about 1 minute left, but I want to make sure that if there's anybody out there that wants to tell us just 30 seconds, if they have something that helps them define success, or with how do they champion their own success story, that we give some of our friends out there a quick chance to say hello before we wrap up.
I could just say, hi everybody, happy Healthcare Simulation Week. What I've been trying to do more is to share stories outside of our core group of simulation peers. And I think it's great to share success stories even within organizations, but the more that we can get people, our patients, our family members, our friends, to be talking about the value of simulation, that's, I think, when we've really made it. So I encourage everybody to not only share within, but also share to people that don't want to hear, share to people that don't have any idea what we are doing. We're heading up in the next 2 weeks. I'll be in DC twice, and we'll be meeting with some representatives, House representatives, to really share where we're trying to go within the society and through simulation.
Thank you, Haru. And thank you all for joining us. Again, as Priscilla said, IMSH registration is now open, and we hope to see you throughout the rest of the week during Healthcare Simulation Week. Have a great week, everybody. Talk to you later.
And
we got another champion circle on Thursday.
Week again, everybody. Celebrate. Thank you.
Thank you, everybody.
Thank you.